Hey, this is Chris, keeping it real, doing a screen capture COVID-19 update. It is Saturday, June 27th. Yesterday, the governor of North Carolina required mask wearing just about anywhere, unless you're outside, which I believe is based on a faulty understanding of the data, but instead of arguing a political dimension to it, let's just look at the data, shall we? We can see from the tracking the coronavirus curve in North Carolina, which is this graph right here, starting at the beginning of March. For the since June 14th, their coronavirus cases have climbed ever so slightly. Per day, the 7-day rolling average has gone from 1225 to 1283, hardly a super spike. But as I mentioned in a previous screen capture video, when we look at coronavirus testing, it is following a similar upward curve. So it just makes sense that as you test more people, you're going to find more cases. The Department of Health and Human Services, Mandy Cohen, has mentioned that recently the percentage of people who are being tested who test positive has risen to 7%. I have no idea where she's getting that figure. These figures all come from the North Carolina Department of Health and Human Services and are merely being relayed by WRAL. So if yesterday the rolling case average was 1283 and the rolling testing average was 1773, then you would expect that the new cases would be 1,700 or something, because that would be 10%. But it's not. It is 7% still. So North Carolina has not really seen a spike in cases. I know the news often sensationalizes things, and this is one of the things it does. I could not find the story again today. Stories come and go on the internet, which is what I don't like. There's never seems to be really a library of stories you can go back and check. But all of the data, when people like the CDC or other countries go do testing in a scientific way, in other words, when they go out and it's like a survey of coronavirus testing. And so they pick a representative sample just like you do in any other statistical analysis, and you try to figure out, and what they're trying to figure out is how many people actually have the virus. And from the very first study that was done, the number is 10 times the reported cases. That is what it has been since this pandemic started. Which means, and now I'll have to find that other graph. Here we go. Which means that in North Carolina, there's officially 59,081 cases and 1,347 deaths, which is not a super great ratio. But if you consider that the actual number of cases, according to the CDC and other reputable health reporting agencies from around the world, the actual number of cases in North Carolina is actually more like 600,000. So when you start talking in terms of having 600,000 actual cases, and these are just people that probably didn't even know they had the disease, therefore they haven't gone to the doctor. There's been no systematic widespread testing in North Carolina as of yet, which would be nice to have so that we could actually get a grip on what's going on. But somebody's really dropping the ball. I don't know who it is. Well, somebody in the government's dropping the ball. So if we look at the number of deaths, 1,347 out of 600,000, we come up with a death rate of 0.26%. That's what I figured yesterday. These numbers have changed a little bit, and I don't feel like whipping out the calculator just now, but it is, let's just call it 0.25%, 0.0025 are the number of people who are dying from this disease. Tragic to be sure, but it's not something, in other words, it's not good news for the people who are dying, and it's not good news for the people who love them. But it is great news for North Carolina, because it means this virus is not nearly as devastating as everybody thought it was going to be when it first started. I'm sure we all remember hearing death rates of 1 to 5%. That is simply not happening, and there's no reason for anyone really to be overly concerned unless, of course, you have an underlying condition that makes you more vulnerable to dying, such as COPD, hypertension, diabetes, and a small list of other things, other underlying conditions that makes it more difficult for your immune system to fight off viruses. Because that's the only way you live through this. It's a virus. There is no vaccine. There is no medicine that magically will cure it. That viruses don't work like bacteria. So I just wanted to go over that with you. It is really good news. I did want to talk about the new deaths, because if we're talking about things spiking, you would expect that new deaths would follow the same curve as the testing graph and the new case graph, but it does not. It has remained. I mean, we have some ups and downs. 22 was the highest 7-day rolling average, and just forget these bars. They're important because it's their numbers being reported, and that's what the 7-day rolling average is based on. But all these health departments and all these other places that are doing testing, it's not like there's this mandate that they get in their test results every day, or it's not even realistic to expect that if someone's tested in one day, that result is reported that one day. What I suspect is happening is that most places are just waiting. They're doing it once a week, and they're dumping their data into the system on Friday and Saturday, or Saturday. So this is good news too. It means that even in the face of 10 times more cases than we thought, the death rate is incredibly low. And that is good news. And we need to start focusing on good news, and we need to start getting some perspective about how serious this pandemic actually is. Turn off the news and don't listen to it anymore, because they're not telling you the whole story when they run these sensationalized stories about how bad things are out there. They're not. This is what's called cognitive dissonance, folks. When somebody's telling you something's going on and you go out and look at it with your own eyes and you don't see that, and you don't see it, and it's not because it's not because I'm making stuff up. It's just because I can look at the stats and see it's not bad for myself. And that's what you need to do too. You need to think for yourself. Need to continue to be vigilant about social distancing, being careful around people who may have the disease. My opinion on masks has not changed one little bit. I don't think they do a bit of good. There's no scientific basis upon which to say a mask does do good, especially unless it's an N95 mask, and then I will accept that would be highly effective. But we basically are not allowed to have those because they have to be saved for the medical profession. And so a surgical mask is better than a cloth mask, but it's not much better, and it's not designed to keep you from getting sick. And it's only marginally effective at keeping other people from getting sick. But that is just my non-medical opinion. All right, you have any questions or comments, leave them in the section below. Like and subscribe. We appreciate when you do, and we'll see you on the next video.